Short rhymes and phrases have proven to be a great tactic to help us remember how to act in dangerous situations. Whether we're on fire or approached by a bear while hiking, these cues have prepared us to stay alive. But we may not be focusing our efforts on the most pressing issue. Even with fentanyl-related overdoses being the top cause of adult deaths, how many of us truly know what to do in the event of an overdose?
I saw a lot of people dying from opioid overdose. It's completely preventable, and their access to medication and interventional tools that could save their life wasn't there.
That's Theo Krzywicki, founder and CEO of End Overdose, a nonprofit that provides education and medical intervention for drug-related overdoses. Krzywicki, who's been sober for 12 years, started the organization in 2018.
I used to just walk to methadone clinics around LA, and I used to just train them to use Naloxone. And then that turned into training people at drug treatment centers. Then that turned heavily into like the nightlife scene, and it just kind of grew from there.
Krzywicki's also a full-time firefighter paramedic, which means he's no stranger to our nation's drug epidemic.
I work in downtown LA, and we go on like 6 overdoses a day. The assessment that you take and the steps that you follow to like reverse an opioid overdose are relatively straightforward. For me, I wanted to make sure that people had that information more than the medication, more than anything else, that they had the information available to them with the click of a button that they could save somebody's life if they needed to.
Which is what inspired End Overdose. The organization started out training around 100 people each month, then magnified its reach during the pandemic.
Now we train 6,000 people a month online, and then we train 4,000 people in person, not including like our 13 college groups that all conduct their own trainings on campus. My goal is to make sure that every single person in this country has access to this training and has taken it. Just in the same way that the American Heart Association really pushed CPR, I think we need to push this the same way.
Krzywicki knows he has a limited window of attention to get the most important information across, so he focuses on the 3 signs of an overdose.
Our training is real simple. It talks about the opioid overdose triad, which is pinpoint pupils, respiratory depression, and decreased level of consciousness, just like a quick signs and symptoms for you to really hold on to something. So if I can get you to identify and I can get you to respond, we did it. That's the biggest thing. And the biggest thing that I try and reinforce is you making the decision to act, right? You making the decision and the choice to respond, right? Because the thing that kills people the most is somebody, they see something looks weird, they see something looks wrong, but they just doesn't click in their mind. They're like, I don't really want to get involved. Maybe it's not, right? Maybe that person's just trying, I don't need to deal with this, right? And that can cost someone their life.
Of the 3 telltale signs, Krzywicki says looking for the pinpoint pupils may be your best option to figure out if someone has overdosed on opioids.
You can lift up the eyelid, you can shine the light into their eyes, and if it remains like this tiny, tiny little pinpoint, man, that's an opioid overdose. And the medicine that you would use to help reverse you in that opioid overdose, it's not going to have any side effect if you use it on somebody that's just like drunk.
This medication is called Naloxone, and though paramedics like Krzywicki deliver it directly into a person's vein, that's not an option for those of us who aren't medically trained. Instead, 2 other options have been created that anyone can administer. Intranasal is delivered through the nose, and intramuscular is a shot directly into a muscle.
Intramuscular kind of sounds scary, right? Because you have to use a needle, but it's really not that hard at all. People that use an EpiPen constantly are doing this all the time. It's the same type of principle. You would drop the medicine. It's already pre-dosed for you. So you just pull up all the fluid that's in a vial and you would inject it into like a large muscle, like a hamstring or a glute or a quad or like the deltoid on your shoulder. And it should work relatively quickly, like in less than 10 minutes. The way that's the most popular is intranasal, right? Where you could take a dose of like Cloxato or Narcan, you could put it into their nostril, depress a plunger, and the medicine will get absorbed through capillary membranes and taken up into the bloodstream.
The main issue with an opioid overdose is that it messes with the brain's ability to communicate with your lungs. Naloxone reverses an overdose by blocking the effects of the opioids and restoring a person's breathing. But if you don't have Naloxone, what else can you do?
If that person gets oxygen, their outcome is going to be great. If you can rescue breathe for that person, which is 1 breath every 5 seconds, And you don't have to inflate them like a balloon, right? You just kind of lock lips with this person and just give them an exhale every time you need one, just to see their chest rise up a little bit. Don't worry, you won't hurt them, right? You can save their life. If that's the only thing that you did, they had a pulse, they just needed the oxygen, you rescue breathe until a paramedic arrived, like, you would save their life.
But harm reduction isn't only about being on defense. Fentanyl test strips offer a proactive way to prevent an overdose. Unfortunately, they're not foolproof.
One of the problems with fentanyl test strips is they don't test for every analog of fentanyl, which is the big thing that people are really concerned with. They make new analogs all the time, so it's not a foolproof thing. The important thing with them, though, is that for all those kind of like big encashments in those gross areas, drugs aren't regulated by the FDA. No one's like batch testing for purity. It could just be Dan, just like, yeah, it looks good, right? They're really easy to use, right? It's just a dipstick.
All you'll need is 10 milligrams of the drug and about 15 milligrams of water. Mix both together, leave the test strip in the solution for 15 seconds, and then you'll be able to see if there's fentanyl present. So while we can't force people to stop their drug use, we can help keep them alive. Unfortunately, Krzywicki says the solutions aren't as well known as they should be.
It shouldn't be more challenging for you to get the information on how to save a life and the medicine that could reverse an opioid than it is for you to actually get that poison that's killing everybody, right? That's insane. You should be able to get Naloxone right now with a click of a button. It should be way easier for you to get. And that's what our goal is, right? It should be as easy as you clicking a button to get fentanyl test strips, right? Because you're consciously making the decision, hey, I just want to be prepared for this very potential crisis in the world that we live in now.
Which is why the End Overdose website offers test strips and Naloxone that will be delivered straight to your door.
If you live in LA, we'll come to your facilities, we'll train all of your people, we'll give it to you for free. And we make it as accessible as possible because the reality is you should have it easier than the thing that could kill you.
Krzywicki says the nonprofit has big plans for the future, but their first mission is making the education in life-saving medicine accessible to everyone. You can get all of the services on their website, endoverdose.net. You can find more information about Theo Krzywicki and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Initially, people thought, well, just remove the factor and it'll be fine. Not necessarily, because then you want to make sure it doesn't skew results in another direction.
Figuring out how to correct racial bias in lab testing.
Then the doctor with a unique superpower to diagnose his patients.
If you are gasping for air, I feel it in my body. If you're having a panic attack, I feel it in my body. And that's something that happens all the time with everyone I see.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I wasn't that mindful of how much sugar makes me crash in the afternoon, how much sugar makes me really jittery first thing in the morning.
The upsides of eating less sugar. Then,
that is not just something that we use for online gaming, booking holidays, or Netflix streaming, but it's really essential for many of our most basic rights.
The debate around subsidized internet. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.